According to research, dandruff affects approximately 50% of the general population worldwide. That's nearly 4 billion people. And while it isn't contagious or life-threatening for the most part, it can be quite annoying and oftentimes embarrassing. The good news is that dandruff is very treatable and it doesn't cause long-term problems. I'm Dr. Freddy Gomez. Our goal here on the program is to help you better understand the care you need and deserve. You're watching MedTalk Health Talk. Not a lot of people know this, but dandruff actually has nothing to do or has little to do with poor hygiene. It's actually a result of excess shedding of dead skin cells from your scalp. Now, here to help us learn more about this condition, with us is Dr. J.V. James Barrett. He's a dermatologist from the Philippine General Hospital. Also with us is Dr. Ana Aurelia Santos, who is a hair specialist from East Avenue Medical Center. Now, I'll start the conversation with Dr. J.V. muna. How can these symptoms of dandruff specifically affect a person aside from the obvious flakes on their head?
The most prominent complaint when it comes to dandruff, aside from the flakiness, is the itch. And the itch is quite persistent and it's quite irritating. So it's hard to do like your regular activities if you know it's itching, and if you're gonna scratch your head sometimes, like when you're at school or at work, it's gonna be a bit embarrassing also.
Sometimes the lack of shampooing can cause an oily buildup in the scalp, resulting in dandruff. However, even if you wash your hair regularly, you can still get those pesky flakes. So, Dr. Tak, ano ba talaga yung rason kung bakit nagkaka-dandruff ang tao?
Stress definitely plays a role, as we have observed during this pandemic, where in a lockdown situation, our situations have changed from our usual day-to-day lives. Increase in oil in sebum production can play a role because this creates an environment na favorable dun sa yeast na nagkukos ng dandruff, which is Malassezia.
Now, it's no question that we're all living under very stressful times, and stress is, as you mentioned, linked to an endless range of health problems, including hair and scalp issues. Dr. JV, what happens kapag na-stress ang tao? Pag umabot doon, how does this trigger dandruff?
Yung stress po kasi, syempre, it kind of dysregulates or it kind of messes up our immune system. So yung sa skin po natin, yung immune response natin, medyo nagbabago. So kaya po nangyayari minsan namamaga yung balat. So like for example in dandruff. For example, there are other skin conditions that are triggered by stress. Yung pinaka-established is psoriasis, for example. Nagpa-flare po yung mga pasyente nating may psoriasis kapag nasa-stress sila. Sometimes, more commonly, acne also can be triggered by stress as well.
Now, there are a lot of myths that surround the causes of dandruff, especially when it comes to hygiene. Now, the truth is the condition can develop kahit malinis ang scalp natin. Kaya, Dr. JV, when it comes to washing our hair, when is it too little or too much?
It's more of how oily your scalp can be. No? So, meron pong iba, especially for women, they don't shampoo as frequently because yung natural na sebum ng hair po natin ay yung nagbibigay ng parang magandang gloss at saka softness ng hair. No? So, pero po kung ikaw ay prone to dandruff, a more regular washing can actually help kasi it gets rid of the oil. And the quick tip talaga is to just increase the lather time or tagalan nyo lang kung nakababad yung shampoo sa buhok ninyo if prone kayo mag-dandruff para po mas matanggal yung oil kasi nga po it kind of promotes sometimes an environment wherein seborrheic dermatitis or yung dandruff can happen.
That's why I'd like to ask Dr. Tak, when it comes to dandruff, ito ba isang condition na merong lunas pang habang buhay or is this something that those with it have to learn to live with and control it and maintain it?
Definitely, our patients with dandruff, napansin nila na kahit they consult their dermatologist, prescribe medications, pabalik-balik pa rin po. So, I would like to say that it can definitely be controlled. But it's something po na you have to watch out for, avoid the triggers, avoid yung mga factors po na pwedeng mag-aggravate nito para po makontrol natin yung symptoms po of dandruff.
Now, if the skin on your body becomes scaly or itchy, your first thought might be because it's dry. But dandruff isn't necessarily directly caused by dryness. Now, when your scalp is red and flaky, it's usually the result of some form of inflammation. Dr. Tak, explain natin to. Anong role ng inflammation pagdating sa dandruff?
Usually po kasi kapag nangyari po ang inflammation, kapag nakakamot natin yung ating scalp dahil nga makate due to dandruff. So, kapag nakamot natin, there may be some redness na nag-result. So ito po, we have to watch out for this because this can lead to other factors that can worsen our dandruff.
A flaky and itchy scalp doesn't always mean that you may have dandruff. If you've been using medicated shampoo for a week or two and don't see any improvement, the culprit may be something else. When we return, we'll talk about what might be causing your scalp to itch. We're your connection to healthcare. You're watching MedTalk Health Talk. Now that the country is starting to loosen up its quarantine restrictions, we're seeing more and more people out of their homes and exposed to the environment. But how is dandruff and the weather connected? I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. For the most part, we only have one climate here in our country. Very warm. But changes in temperature and humidity can be a trigger for dandruff. Dr. JV, how can the change in season, change in weather, affect a person's scalp?
For dandruff, for example, ang established is when it gets triggered on the cooler seasons. No? But it gets better usually when it's warmer, when it's summer. No? When it's like summer, for example, they say that the sun exposure actually helps relieve the dandruff. No? Like with the exposure to the sun, it might improve actually some cases of dandruff.
Now, Dr. Tak, marami rin nagtatanong, can wearing a cap help with dandruff or does it actually worsen it?
Actually po, in wearing a cap, it doesn't actually do anything, no? So I think the patients wear the cap more of kasi medyo nahiya sila na may mga visible flakes on their scalp. So I would say po, no, it has no effect.
Dr. Tak, marami rin ang naniniwala that not rinsing off shampoo or other hair products, yung mga gel, mga mousse, or mga wax, can this directly cause dandruff? Or is there any truth to this?
It can play a role because these products, kapag hindi po binanlawan thoroughly from the scalp, it can cause product build-up. So we really recommend that when you shampoo or you use these products, you rinse it thoroughly when you shampoo your hair.
And Dr. JV, when it comes to dandruff, can this get to a point where merong malalang sakit ang isang tao? Can this be a cause for infection?
Yung dandruff po kasi is very, like, it's formally called seborrheic dermatitis and the dandruff is the mild form. No, sometimes it can worsen, no? And mas, yun nga po, yung parang dinescribe natin kanina, mas makakapal na, mapupula na patches, mas makakapal na flakes yung pwedeng mangyari. It can extend to the face, the ears, the nose, sometimes po to the upper chest and back kung saan marami din tayo yung sebaceous glands natin or oil glands natin. No?
Yung paglipat ba ng mga different products, let's say may isang taong gumagamit ng shampoo, they tried something else, can this lead to possible dandruff?
Not necessarily. No? The rotation of shampoos actually might help, no? But you have to consider that there has to be active ingredients that may help with dandruff. No? Pero just rotating shampoos in general that doesn't affect dandruff per se.
Now, aside from dandruff, there are other reasons why your scalp might be itchy. Dr. Tak, please explain some of these conditions to our viewers. Ano yung mga pinaka-common dito that Filipinos might be able to experience?
We have scalp psoriasis, so this can also cause scalp itching. So definitely, if your dandruff does not improve with anti-dandruff shampoo, then definitely consult your board-certified dermatologist because it can be something else. We can also have contact dermatitis, so the use of maybe the dyes, hair dyes we use in our hair. This can also produce itching in our scalp kapag hindi po tayo hiyang dun sa dye. Also, in newborns, there is a condition called cradle cap. So it's greasy, yellowish, brownish scales on the scalps of newborns, which usually goes away on its own and does not usually require medical treatment.
That's a good segue actually, Dr. Tak. You mentioned that pwede rin magkaroon ng simptomas ng dandruff ang mga baby, mga bagong panganak, which can be very anxiety-producing, lalo na sa mga first-time parents. Ano mga advice mo pag meron silang nakitang kakaiba sa kanilang anak? What should they do? Anything? Kailangan bang consult kagad? Or are there some home remedies that may be able to ease the experience of the baby?
Yes, so sa ating mga mommies na may ganitong experience with their babies, first of all, don't panic. Then you can massage mineral oil on the baby's scalp to loosen these flakes and use mild shampoo to gently wash baby's hair and rinse it thoroughly sa scalp ni baby. Then brush hair gently with a brush that has soft bristles. Again, don't worry, it usually goes away on its own.
Dr. JV, earlier kayo ni Dr. Tak were mentioning about seborrheic dermatitis. Kapag ang isang tao ay may dandruff, automatic na meron din siyang seborrheic dermatitis?
Yes, technically that's true. Kasi seborrheic dermatitis po talaga yung tawag dun sa sakit. And dandruff is the mildest form of it, usually.
What are other conditions that fall under this that could be triggered and could lead to more serious conditions?
It's more of pag mas malala po siya na umaabot yung hanggang mukha. Like ang term na lang po talaga namin, seborrheic dermatitis. Meron po yung there's this entity, especially in, for example, with persons living with HIV, na medyo severe siya, tapos nagmumukha na po siyang psoriasis. They say it's pseudo-psoriasis. No? Some believe na parang seborrheic dermatitis and psoriasis exists in a continuum of some sort. Kumbaga parang pwedeng mag-lead on to the other, pero hindi po naman yun, it not necessarily is true. No? Although minsan parang it's really just a very severe form of seborrheic dermatitis. And seborrheic and psoriasis can be a totally different thing.
Okay.
Altogether.
So this is just for our viewers to stress the importance na kailangan talaga magpakonsulta sa dermatologist, lalo na para maka-achieve tayo ng tamang diagnosis ng problema. Now, Dr. Tak, I'd like to ask, what is the worst thing that people do to their dandruff that makes it worse?
Usually when they pick off the scales, kasi I understand sa ating mga patients, very tempting na kutkutin, lalo na pag ang kati-kati ng ating scales. Actually, it may have a tendency na mas kumapal palalo yung scales kapag kinukutkot natin. And of course, pwede rin na magkaroon ng infection. Some also resort to other parang to their own parang mga concoction that they apply on the scalp, which can actually make it worse.
Now that we know the different causes of dandruff and other scalp conditions, we'll talk about how to treat and prevent these effectively. So stay with us. Your health is our mission. This is MedTalk Health Talk. The itching and flaking from dandruff can almost always be controlled. Now, the best way to get rid of dandruff is to use medicated shampoos and some topical treatments. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. For mild dandruff without a specific cause, over-the-counter products can help manage flaking as well as the itchiness. Dr. Tak, what are some of the ingredients that we have to look out for when buying anti-dandruff shampoos?
So please keep in mind these ingredients. These ingredients will help in the controlling of dandruff. So ingredients such as ketoconazole, zinc pyrithione, or selenium sulfide. So these ingredients will help in controlling our dandruff symptoms.
Okay. So Dr. JV naman, is there a right and wrong way on how to use these shampoos for dandruff treatment?
I think the most effective way to use it is to use like a more generous amount. So you use around 5 to 10 ml of the shampoo and you lather it mostly on the scalp. No, it doesn't have really to go to the hair. And for women, for example, or with men who have longer hair, they can use actually different shampoo for their hair. And the medicated shampoo usually just stays on your scalp. And if affected din po yung other areas like yung dito sa eyebrows or sa gilid ng nose, you can actually lather them on. And then you can leave it on for around 3 to 5 minutes and then you rinse them. And usually, you can just use it around 3 times a week.
Now, for those who want to go for home remedies to treat dandruff, Dr. Tak, when it comes to home remedies, you touched on this earlier, no? That very careful dapat ang mga viewers natin when especially doing home treatments, lalo na pag passed on yung information ng kaibigan or kapitbahay. Are there any signs that could tell na things aren't going so well? Anong mga red flags ang dapat alalahanin ng mga viewers natin when it comes to home remedies or even the shampoo that's used for dandruff?
Yes, so we have to be careful when we self-medicate. So, ang mga red flags that we have to watch out for na baka nga hindi talaga nag-work yung ginagamit nating home remedy. Kung mas lalong dumami yung flakes, mas lalong kumate, and baka namamagana or namumula or nagiging masakit na or may painful sensation in our scalp.
Can dandruff lead to hair loss, permanent hair loss?
Yes, so of course, you have to consult your board-certified dermatologist to give you the proper management. Huwag po palalain ang ating dandruff, huwag hahayaan na mas lumala ito. Kasi pwede nga pong dulot po ito ng paglalagas ng buhok.
Dr. JV, aside from yung mga treatments natin, we always want to emphasize that prevention is better. What's some good prevention tips na you can give our viewers when it comes to dandruff?
First, once na-establish na po yung dandruff nila, sometimes yung sa medicated shampoos natin, you can actually maintain them. Like you can use them once a week para ho, kumbaga meron kang pang-control ng dandruff mo during certain periods of time. Also, syempre, if you know that stress can trigger your dandruff, no, you try to ensure, like you can try to ensure na hindi ka masyadong stressed. Although that might be difficult to do.
I think that would be very difficult to do, especially nowadays, Dr. JV. Dr. Tak, any advice for our viewers when it comes to dandruff and probably trying to prevent it?
To add to what JV said, so we can avoid using hair products that can actually irritate more our hair and scalp. So these products are alcohol or bleach. And I think he also mentioned yung stress, which is very hard to do, to avoid during this time. So yes, do take up a new hobby, do light exercises, kahit walking around the house lang or around the outside of your house. Do yoga and deep breathing techniques to better manage your stress.
This discussion was definitely very helpful, and thank you to our guest, dermatologist Dr. JV James Barrett and hair specialist Dr. Ana Aurelia Santos. Maraming salamat sa information and expertise ninyong dalawa. Dandruff can be annoying and embarrassing at times, but it usually doesn't indicate a more serious health issue. Itchiness and flakiness often respond well to over-the-counter shampoos and scalp treatments. And despite these stressful times, make sure to make time to take care of yourself. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk.